foundationally, the bladder is a very hormone sensitive structure. And so when do these urinary symptoms start? They start in that as you kind of get into this perimenopause, menopause time. Urgency, frequency, urinary tract infections, it all kind of goes together. So in my opinion, there is a foundational element to get the hormones right. So that can look like local hormone therapy, but we even often see systemic hormone therapy as very helpful for this tissue. As I said, we know there's testosterone receptors in the urethra, in the bladder, in the pelvic floor, in that vulvar vestibule, which is bladder tissue. And so it's really important to think about that foundational element. So if you're using vaginal hormones optimally, there's some data to show that if you still have urgency, you could switch from estradiol to vaginal DHEA, and that may help your urgency. There's a big role for pelvic floor physical therapy to get the muscles to not squeeze so much and to work on the areas. And then we have a whole toolbox of things for bladder leakage, bladder urgency. There are medications, there are surgical options. There's a whole sort of pathway. But what I find is that I don't often need to go down that pathway because so many of our patients do well when you get the foundational elements right. And so I think some of my colleagues are overusing those pathways by not focusing on the foundational element.